I was proud to sign House Bill 2144. This bipartisan bill requires health insurance plans to cover comprehensive biomarker testing for patients who need it.
Biomarker testing has absolutely revolutionized the way in which we treat cancer.
Biomarker testing gives you personalized medicine.
Biomarkers can save money because you're not wasting time on unnecessary treatments.
With biomarker testing, we're able to understand an individual approach to each patient if we identify biomarkers for which we have treatments.
Precision medicine is what it is.
Historically, back in the day, we used to do chemotherapy or treatments that were not necessarily individualized to the person or even the tumor.
I went through 9 months of breast cancer treatment, and following, I was put on hormone therapy to prevent the recurrence of breast cancer. I had a myriad of side effects that really impacted my quality of life. Thank goodness, 8 years into my treatment, biomarker testing came along. It allowed my doctors to go back, test my tumor, and they discovered that the medicine I was on was doing absolutely nothing to prevent breast cancer from returning. I was able to get off of my medicine, and my quality of life went right back up.
Unfortunately, we encounter patients who do not have coverage for biomarker testing all too frequently, and it is absolutely puts us a little bit in handcuffs in terms of giving them the best possible treatments.
Biomarker testing is expensive. You can imagine Joe, construction guy, who comes in and has been tested with cancer, and the doctor says to him, you could have this test done, but this is how much it is, $3,000 to $5,000. And he's thinking, that's 3 months of rent.
Being immersed in the breast cancer community over 13 years, I have heard story after story after story of women who did not receive biomarker testing because they could not afford it.
Thank you for hearing this bill today. I sponsored a bill this year to help make biomarker testing available to all Arizonans.
It is shocking to me that everyone does not have equal access to healthcare testing, especially when it can make the difference between life and death.
This requires health insurances to cover comprehensive biomarker testing when supported by medical and scientific evidence.
The American Cancer Society Cancer Action Network strongly supports HB 2144, and we thank Representative Cobb for her hard work on the bill.
Our bill passed with overwhelming bipartisan support.
This allows more people to get the treatment they need quickly, ultimately saving lives. By continuing to work together, I'm confident we can get more people the care they need sooner.
I'm so incredibly proud of the state of Arizona for passing this into law and to allowing for coverage for biomarker testing. It's basically allowing us to ensure that our patients have access to biomarker testing if oncologists or physicians feel that it is required or necessary for their disease site and disease type.
Biomarker testing is not about partisan issues. It's medicine, it's about what's good for the patient. It spans all parties and walks of life.
I hope the Arizona law will make it easier for other states to pass a law like ours.
I'm grateful to everyone who is dedicated to fighting cancer here in Arizona and around the world. Thank you, and God bless.